In times of struggle, we see the true greatness of the American character. Americans from all walks of life are rallying together to defeat the unseen enemy.
The president is talking about hope for people.
The president's been working
and in speed, but also from the small.
He said everything that I could have hoped for.
He is being the kind of leader that people need.
I can tell you the actions he has taken, his team has been on it.
He did what a president's supposed to do.
In times of struggle, we see the true greatness of the American character. Americans from all walks of life are rallying together to defeat the unseen enemy.
The president is talking about hope for people.
The president's been working nonstop.
The president has demonstrated excellent, bold leadership.
He said everything that I could have hoped for.
He is being the kind of leader that people need.
I can tell you the actions he has taken, his team has been on it.
He did what a president's supposed to do.
There's spirit in our country like never before.
They're doing things that have never been done before.
This is record time for the development of a vaccine.
The one that really deserves the credit are the American people.
We're going to get through this and come out stronger than ever before.
Our message is to all Americans, we love them, we're with them, and we will not let them down.
I'm Donald Trump, and I approve this message.
Buenas noches, and welcome to our very first Latinos for Trump online town hall. With me tonight, I have two distinguished guests, Dr. Joe Torres, who is medical director and founder of Florida Sports and Family Health Center, and Alfredo Ortiz, who is president and CEO of Job Creators Network and also a member of the Latinos for Trump Advisory Board. Thank you for joining us. So I think one of the first things that we're seeing off the bat is that the Latino community is disproportionately being affected. There was just an article in the USA Today on March 25th saying that coronavirus disproportionately hurts Black and Latino voters in terms of layoffs. So Alfredo, I ask you the question, how can Latinos be prepared to handle what we're seeing as the economic impact of the coronavirus?
Yeah, Mercy, thank you so much. I mean, that is a great question. I mean, overall, we see small business owners across the country are being impacted, across the board. There are 30 million small businesses across the country, Mercy, and about almost 5 million of those are actually Latino businesses. Latinas actually make up a good proportion of that as well. It's one of the fastest growing sections of our economy. As you know, Hispanics are entrepreneurial in nature, and this is why it's impacting them disproportionately, as well as the hourly workforce. And this is something why I think one of the main things, we're going to talk about this a little bit later, is called Phase 3 of the stimulus bill, or I call it the Lifeline bill that was just passed and signed into law by the president this past Friday. It's going to be so critical to help our small business owners or their employees to be able to survive this crisis that was really a silent crisis. Nobody saw it coming. Nobody could prepare for something like this. But, with unprecedented actions and speed at which this president has been able to work with private industry, we are excited to see what's happening, and we are encouraged because small business owners are going to get the help that they desperately need, and their employees, again, across the country. And as I mentioned, Hispanics are traditionally such an entrepreneurial demographic by nature. And we all know that, right? We are all actually Hispanic business owners in some way, shape, or form, have or currently are. And so we know that this help, which is desperately needed, is on its way.
Thank you, Alfredo. Dr. Torres, we have our abuelitos, our abuelitas. They're home, they're worried. They want to know when this is going to end. What advice are you giving to our abuelitos and abuelitas out there who are basically saying, I know I got to stay home, but this is tough? I mean, how do we get through this from a health perspective?
I think what I would tell them from the beginning is, estén tranquilo, esto va a pasar. I think that as healthcare providers, as physicians, as sons and daughters, we need to reassure them that we're going to do okay. We also need to reassure them that we want them to stay home. We want to explain to them what the risks are in going out there, what the risks are in confronting something like this when you're out there, to be careful, to use proper hygiene. And it's time for families to pull together to basically, in our case, using the telehealth, telemedicine system, to have a family member that has a computer. Maybe we don't want them to go out to the doctor, but they need to see the doctor for whatever reason, whether they need a medicine refill, whether they need a prescription called in, whether they need just to see the doctor, something has changed. So the ability to use these new innovative systems in our practice has changed medicine. Will change it for time to come, because the advice, let us help you. How can we get you in touch with your doctor? And from the physician perspective, is we're making it easier for them to do so.
Dr. Torres, you talked about this innovation, now using telemedicine, telehealth as being a new way for patients to talk to their doctors. This brings a question to you, Alfredo. When you're looking at innovation, it's clear that President Trump is someone who completely understands innovation. And I think he's done something remarkable, which is be able to combine the private sector with the public sector to really come up with innovative ways to handle coronavirus. Give us a glimpse, give us an insight as to what the president's been able to do.
Yeah, absolutely, Mercy. I have to tell you, that latest press conference where he was talking about that fast test, the 15-minute, 5-minute test from Abbott. I mean, when you heard the president speaking along with the industry executives, I could have not felt more proud about this country and the way private and public has come together to really tackle this. I mean, this is unprecedented. This felt a little bit almost like after 9/11. This almost, obviously I wasn't around, the World War II piece, but in terms of how our country rallied around, a common enemy. I mean, it's really a proud time actually to see the way private enterprise and public, how government has come together, but really the way the president has brought these two sides together is really unbelievable. We were talking just now about the telehealth and telemedicine, Mercy. I mean, for example, he brought the industry executives on the insurance side to the table, got them all to agree, for example, that will be covered. There's no copay related to it. It's fully covered, along with CMS, so Medicare and Medicaid. I mean, this is the kind of stuff that changed almost overnight. And then just watching him rally the private industry to be able to do things that we desperately need, that our frontline healthcare workers desperately need, is just really unprecedented, and really is actually a very proud time. And with all the crisis that's going on, we kind of forget to focus on that, and we really should, because this is really what makes America great. And the innovation, though, that entrepreneurs across the country, and quite frankly, from small, medium to large, we're seeing a lot of small business owners. I'm getting a lot of emails from folks saying, I want to know what to do. I want to do my part. How can I change my manufacturing facilities to accommodate the needs of this country right now? It is actually a very great time, to be proud of our country, and really the work that the president has done. I mean, this is leadership from the top, and he has brought together the right people with the vice president along to lead the coronavirus task force. It really is a pretty unprecedented, and it's amazing to be watching it from my perspective.
Yeah, when you've been able to see companies like Ford and GM, I mean, you got
Right.
Mike Dell from My Pillow, coming up with innovative ways where they're creating masks or helping with the ventilator production. It is truly something that is about the American spirit. Yeah. And so I find that to be remarkable. And it's really because I think it's President Trump challenged them and said, let's take this to the next level and let's get the supplies that we need as our nation is, as it's getting, the crisis has been growing. So I think that's been an interesting phenomenon to watch. And it really has been because of President Trump leadership. I don't think.
And Mercy, if I can also add too, and he's saying, you know what, and if we basically fulfill the demand on our side, we're going to take the extra, whether it's ventilators or masks or, the N95, face gear, and we're going to give it, to other countries that need it as well. I mean, again, this is the generosity and the spirit that makes America what it is today. And the president really just does such an amazing job of capturing that.
That's wonderful. And Dr. Torres, let me ask you, we're looking at these CDC guidelines. The president this week made that decision to extend the guidelines now till April 30th, where, they want people to stay at home. They want people to make sure that they're following the proper steps and hygiene needed. What's your advice for all of us out there as we're trying to cope during this time? And why is it important for us to follow the CDC guidelines?
Well, I mean, the biggest piece of advice I can give them is that, as they say, the least common of all senses is common sense. Use common sense. Use hygiene. Wash your hands. Use what you have available to you. If you run out of, for example, patients have run out of hand sanitizers, you can make your own. Be innovative, as Alfredo said. This is a time for us to think out of the box. You have to follow the opportunity of working with centers like my alma mater, University of Nebraska Medical Center, and they're working on developing new trials for vaccines. We're working on developing new trials for some of the medication, like the hydroxychloroquine, the chloroquine that's being out there, with combining it with a Z-Pack. There's a number of trials with antivirals right now. So the CDC is really on the forefront, and I think Dr. Fashi's done a great job in explaining that. The important thing for me, obviously, is watching the leadership of President Trump to lift all these barriers, that we can go ahead and, like working with Abbott for that quick test, it'll give us a positive result in minutes rather than waiting weeks, guiding patients to where they can get this done. So really my job, aside from just taking care of the patients, is directing them, telling them this is where you can go get it done. This is where you know the best place to do it is at, and really just basically putting their mind at ease, from the elderly patient at home to the patients that call us. Today I had about 4 or 5 telehealth conferences or calls, because these patients are worried. So it's a multiple role. We're working obviously with small business owners. Being a small business owner myself in my offices, it's impacted us, but I think we're going to get through this. I mean, God willing, we have good. That's the most important thing.
I think that especially at this time, you need an exceptional leader. And I do think that what we've seen with President Trump is that he is unrelentless. He is just going to keep trying to figure out a way to solve this complicated issue. And what I have found with him is that he's listening to his public health experts, and he's also weighing the economic impact. So he is talking to his economic advisors, and it is trying to find that right balance, which is the top priority being the safety and the health of Americans, and at the same time making sure that our economy doesn't sink. So Alfredo, let me ask you, they moved forward on this bipartisan legislation, the economic stimulus package. We know that this is going to give direct payments to Americans making less than $99,000 a year. We know that they're extending unemployment benefits. How will this help? And I know, I mean, for Republicans, spending is not what they love, but we know that there's this reality that exists, that we are in a time of crisis. As the president says, we're dealing with an invisible enemy.
Yeah.
So walk us through, in terms of the economic stimulus package, how this will help at least provide relief to those families who need it the most.
Yeah, absolutely, Mercy. And one thing, if I could make a really quick point too, you know, the other thing that the president is doing in terms of his leadership, he's showing that from a federal government standpoint, it's not about more control, it's about coordination. And that the real role of federal government is about that. It's not about control, it's about coordination. He's really leaving controls for the governors of the states, which is really where it should be, right? If you think about it, he really is just acting to try to make sure that government actually gets out of the way, and that the bureaucracies doesn't gum up the entire system. And so I am actually really excited about it, because this could be an opportunity where someone says, aha, this is a great time to have more government control. And he's actually showing that it's about less government control and more about coordination. So I just wanted to make that quick point, Mercy, on that. But to your question in terms of, you know, what we're seeing in terms of the phase 1, 2, and 3 packages, I mean, clearly, immediately was that first phase was make sure about testing, make sure that, you know, our first responders, you know, that they're getting the aid that they need, the dollars that's needed out there to make sure we got the right protection equipment out there, the face masks, the gowns, stuff like that. Leading up to this phase 3 that was just passed, people are calling it a stimulus bill. You mentioned how Republicans don't like spending. In this particular case, look, this was a 96-0 vote. The only reason it wasn't 100-0 because unfortunately 4 senators were quarantined because they were exposed to the COVID-19. But really was a unanimous passage in the Senate and really in the House as well. But what through leadership really said, look, we need to make sure that we have cash immediately and as quickly as possible to the American public, to those who really need it most, the frontline workers, our hourly workers, those employees and families that are 150,000 or less. And these are not only checks that are going, for example, a family of four. I believe the calculation is almost $3,500 of checks going immediately to families. Through Secretary Mnuchin's help, really trying to find expedited ways to be able to get these checks to people, really in unprecedented times and in speed. But also from the small business perspective, again, Job Creators Network, which I run, is all focused on small business. And I think this president understands very, very well that small business is really what was leading the charge of that great economic revival that we were just experiencing just a few weeks ago. But because of this silent enemy that hit us on our shores unexpectedly, it really has thrown so much off. He also understands, though, that it's the small business owner that's going to also get us out of this. And so being able to get aid to them immediately through different programs, whether it's through the SBA emergency loan program or whether it's through the new program that's coming out this Friday, to really get checks to people immediately, get cash into businesses, to help people keep their employees on payroll. Because right now, small business owners, Mercy, are making that decision right now. Should I close up shop right now, or should I keep it going and make it through these next 60 days or so, which really are unprecedented times? But these kinds of programs are going to help those small business owners to keep our employees on their payroll, so that when the economy does come roaring, ready. I kind of like making the analogy that it's a little bit like when you put your laptop, you have the choice. When you turn it off, you can either put it on standby or power down completely. The idea here of the president is it's a lot better to just keep your employees on standby, so when that economy comes roaring back up and it's ready to pop up, those employees are ready. They're ready to go, and the employers and the small business owners are ready to open their doors immediately and receive all of that pent-up demand from all of us who have been sitting in our homes or quarantined in place. They're ready to go spend their money, go to the restaurants, go to the movie theaters, go travel like we're used to. And so again, but these actions by the president right now in terms of being able to help all of our small business owners or employees it's going to be so critical to make sure that we get out of this situation as quickly as possible.
Yeah, and you talk about that pent-up demand, and I do think that it's because the fundamentals of our economy, they have been so strong. Perfect. And that's because of President Trump's policies. I could never imagine having Hillary Clinton as president, where we know the economy would have been a lot weaker and it would be a lot more devastating. So I do think that because we've seen strong economic performance, much of it helping the Latino community put more money in their pockets, I think that getting back will hopefully be much quicker because of what the president has been able to create in the first place.
Yeah, Mercy, really quickly, just to that point, if you remember just a little bit ago at the end of last year, 2/3 of new home ownership was actually due to Hispanics overall in this country. So Hispanics were really benefiting, probably one of the biggest demographics that were benefiting from this economic revival. So again, to your point exactly, because we were so strong going into this crisis, we're going to be a lot faster and we're going to get out of this a lot sooner than it would have been if it had been in another situation.
So, Dr. Torres, let me ask you, Dr. Fauci talks a lot about the bell curve, right? It's the, if we don't take certain actions like social distancing and really respecting the orders of what our governors are asking us to do, that this could lead to hundreds of thousands or even more deaths. And the whole goal is to flatten the curve. And, yet in this modeling that you're looking at about 100,000 to 200,000 deaths. And it's obviously, it scares all what Dr. Fauci is saying, what the CDC is talking about in terms of these types of modeling.
I think what Dr. Fauci is saying is correct. We have to look at this realistically. I mean, you have to follow the CDC guidelines. They're set there for a purpose. You have to follow the purpose of social distancing, being careful, using proper hygiene. I think that's going to benefit. Also, the weather, it's changing. Summer's coming, seeing how people are not together as much as they used to be. For example, in New York, everybody hovers together. In Florida, we have the aged, but there's less hovering together. So as you see the weather change, you may see the possibility of this flattening. You also have the advent of the new medications that are being out there. The new medications are showing some promise. The hydroxychloroquine is showing some promise combined with the Zithromax. That's probably the easiest ones we're going to be able to get our hands on early. You have the new trial starting. You also have the new testing, as I said, with Abbott. So we're able to diagnose these quicker. We're able to treat them quicker, earlier onset. We're able to address their issues earlier. So in doing so, we'll hopefully get some flattening of that curve. Now, remember, as we test more, we're going to find more cases. So if you look at the ratio of deaths to cases, it's going to be significantly off as it is right now. I believe it was like 0.08% this morning. Well, it's not that big, but it can grow exponentially as we test. We're going to see a lot more cases. And hopefully with the advent of these new technologies, these new medicines, these new trials, we'll be able to limit the amounts of death. We'll be able to get these patients better, quicker. Also, with the actions that President Trump has taken, getting the ventilators out there, getting the respirator masks out there to the frontline people, getting it to the nurses, to the people that are even, I think of the ones that are disinfecting the emergency rooms and the ORs and the hospital rooms after, making sure that they're covered because they're exposed day in and day out. So the advent of what he has proposed and what he's done and the barriers that he's lifted in this situation, again, to me shows it as a leader that I want right now, as a leader that I'm really looking forward to working with in the future, and him giving the opportunity to the governors of the state to basically take it into their own hands. He's really not pushing, as Alfredo said, he's letting the governors in each state, because they know the state better than he does. So that's a good sign. This is not more government, and we're going to intercede and tell you what to do. We're going to roll these things out, lift the barriers, and then you take it upon yourself. So I find that refreshing as a physician that we have all these things that in our armamentarium that we can now finally use without any barriers.
Let me ask you, Dr. Torres, also, in terms of testing, are you recommending all your patients to get tested? I mean, how does this, there's all this thing of should we have everybody get tested? Should we not? What's sort of your sense in your local community on what is working in terms of the testing, how you're advising your patients?
Well, I'll tell you what we're doing. We're calling all our patients at the beginning of the day. We actually call them the day before. And if anybody calls in, we'll see walk-in patients. If anybody calls in and they have any of the symptoms, we ask them, or they've been exposed to someone with the symptoms, we ask them to go to one of the testing centers right now. The testing centers are being very efficient here in the state of Florida, at least in the Central Florida area, and they're testing these individuals. So basically what we're doing is we're guiding these patients, and we're telling them this is where you need to go. Had one this morning, same thing, he was exposed to someone, he's having some of the symptoms. So rather than exposing a large group of population, meaning coming into my offices, I tell them, look, this is what you need to do. So I've been advising them on that. Also, the contacts, anybody you've been in contact with, you may want to, let them know and get them tested as well. So that's really helped. But as I said, the more you test, the more you're going to find. Remember, coronavirus, even though COVID-19 is relatively new, coronavirus has been around for a long time. In the back of a Lysol bottle, it says that it's effective against coronavirus. So this is nothing new. Again, you follow the CDC guidelines, disinfect, social distancing, etc. And those are things that should just be basic. They should just be basic. Wash your hands carefully. The controversy has come up. Do I wear a mask? Do I not wear a mask? I'm telling patients, the mask is really, unless it's an N95 mask and you're in the area where you think you're going to be exposed, it's really not going to make much of a difference other than keeping you from touching your face, which surprising how many of us do on a daily basis. Same thing with gloves. Dr. Siegel recently just said, don't wear gloves to go out because the glove gives you a false sense of security. Your gloves end up getting dirty. So just wash your hands, clean your hands. So those are things that are common sense issues that the CDC is reinforcing that we really need to take to heart and really apply in our daily lives.
Well, Biden has been touching his face on some of the video conferencing, so I don't know what to tell you. We might have to tell him not to. But let me ask you, Alfredo, you talk a lot, and part of your network of the Job Creators Network is obviously, the fact that it's getting a lot of these questions as to, am I going to be laid off? How much longer can I not work? I mean, there are people out there who are really very worried about not, when even you look at Latinos, I think one of the interesting numbers I saw is that it's a small percentage of Latinos who actually work remotely. So it is a challenge. And so what hope can you give? And I know, obviously this is due to what the president's been able to do from the economic standpoint. of really providing reassurance to the Latino community. But what else are you finding in your discussions with small business owners and with employees of small businesses who are concerned about the next couple months?
Yeah, that's another great question. I just actually got off another call where we were covering that with, there were about 5,000 small businesses actually on that call, wondering, what kind of aid is coming to me. And like I said, we've got a couple great programs. One which is currently in the system right now with SBA. Another one that's that is literally being finalized right now and will be in the works by Friday morning. And this is the kind of financial assistance that these small business owners are clamoring for. It's accelerated timing. I mean, so for example, you'll be able to walk into your local bank where you have a relationship with your banker and be able to, within 72 hours, have cash in your bank, to help cover your payroll for a couple of months, utilities, mortgage payments, for example, rent. I mean, these are the kind. This is the kind of assistance that's really is going to be needed. And you're right. Some of these business owners, they don't have the opportunity or the ability to work from home. So that's why it is really important to be able to give them these kinds of loans to be able to survive. And like I said, for me, it's just watching the way this country is operating and the generosity of the American spirit, and watching how people are helping each other. I'm advising people that if you have even some kind of financial wherewithal, where you have some cash in the bank, buy some gift cards, for example, of local businesses. That will help them, right? I mean, support their drive-through. There's a lot of pop-up businesses, drive-throughs, of these restaurants, to try to stay afloat. We still can do things, and for those people who don't have the shelter-in-place orders, they can still go through those drive-throughs. Those that do, they are still doing deliveries. And so from that perspective, I've also been on the phone, for example, with Uber on the Uber Eats program, try to see how we can work closely with our small business owners and restaurants to help actually the most vulnerable, as you mentioned, the abuelitas and the abuelitos at home, who may not have the assistance, right? We got to get them, and we can't forget about that. There's about 45 million seniors in our country that do need some assistance in some way, and we need to make sure that the help gets to them. We don't want them getting out of their homes and going to these hospitals and walking around and doing stuff, because they're the most vulnerable and exposed. So as a country, we can rally together to help those folks. And, that has come from the top. And I've heard the president say this many times at his press conferences. We got to worry about the most vulnerable. We got to worry about our small businesses. He really understands this well. And that level of compassion and leadership at the top really is something that's very, it's very heartening and warm. It's good to see, really, for us to be able to have that from the president.
So if I'm a small business owner, where do I go? What's the website? How do I get information on these low interest loans? What do we need to do?
Yeah, that's a great point. So the Small Business Administration website, and it's actually in English and in Spanish, has the information on both of the loans, the emergency loans that are currently in place right now, Mercy, and I believe that information is available on this website as well. They can go to our website, jobcreatorsnetwork.com. We have that information there as well. And then this new program, which is called, they call it the 3P program, the PPP program, but it really is to be able to cover payroll for these small business owners that qualify. These are businesses 500 and under. I would basically say I bet you 90+%, 95% of our Latino businesses fall in this category and can qualify. I urge people, don't think that it's a program that you need. Especially this last one, you don't need collateral, you don't need personal guarantees. It's not based on credit worthiness. It's not based on cash flow. It really is to be able to help you over the next basically 2 months to keep your payroll going, to keep your employees ready to go, so that when this economy comes roaring back, and it will, you're ready to go.
So as we wrap up this wonderful town hall, I want to give you both an opportunity to share your final thoughts. What message do you want to tell our Latinos who are listening in today? So I'll start with you, Dr. Torres. From a medical perspective, what message would you want to leave for our audience?
I want to let them know, just be careful, be smart, be hygienely conscious, if that's a word. Basically, you have to really be aware of your surroundings. And take note of what the CDC is telling you. take note of the opportunities that are out there. As Alfredo mentioned, small business owners. I really, my heart goes out to the first responders, the people on the front lines, other than us, that are at the hospitals, seeing these patients, taking care of these patients. As St. Paul said, we got to fight the good fight, run the race, and above it all, keep the faith. And that's what we have to do, because we're going to get.
I think we lost you in the last couple words there. What was your last sentence there?
No, I think, as I said, it was as St. Paul said, we're going to run the good race, fight the good fight, and above it all, keep the faith that, God help us, God bless our president, God bless America. We're going to get through this just fine.
Yeah, there's no question. I think that the faith component is so incredibly important. I know it's brought so many of us together in prayer, and really, I think, it is getting through this difficult time. I have to tell you that just as we all know in our families, social distancing and being Latino, they don't go hand in hand, okay? Because we're all very huggy and kissy. So this has been quite a new way, a new behavior that we've had to adopt in our families and in our communities. But we're also very strong, and we are, doing what we can to follow the advice of our medical experts. I think one place you can go to get information on the CDC guidelines is coronavirus.gov. They have the guidelines in English and Spanish, so you can share also with your colleagues, with your friends, and with your family members. And now, Alfredo, to your point, what message would you like to share with our audience today?
Yeah, thanks, Mercy. I mean, this is an opportunity, really. I mean, we're seeing unity and compassion across the country. We really are. People are coming out; they're doing what they can. We're seeing small, medium, large businesses really doing what they can to help, our country get out of this. It's really encouraging. It's very heartwarming to see. We got to focus on some of that good as well. There are some great stories out there. It's almost kind of a shame that we call it social distancing and not somehow something like just like physical distancing, because we still need to be social. It's just going to be a little bit different. Let's use Facebook. Let's use Zoom, right? Let's use the phone call. I think people are appreciating those moments now, again, that we kind of forgot. We've been spending so much time, quite frankly, with our heads down in our phones. I think we're appreciating what it means now to reach out to your fellow man and to have those conversations. That can still be had, just a little bit of different way. We can use some of the technologies to do that. But again, also think about those small businesses all across the country. Obviously, the first responders, as the doctor mentioned, as you mentioned, hearts and prayers out to all of them. They are putting themselves on the front line, many of them really risking, themselves and getting out there. But really the unity we're seeing is really something that it reminds us all now of what it is to be. The economy was roaring. We had record low unemployment. We had wage growth. I mean, businesses couldn't have been better. We had 8 million extra jobs and people to fill them, right? This has flipped around in a matter of weeks, but it's because we were healthy going into it that we're going to survive. It's just like anybody, right? If we're healthy going into a cold, you get out of it a lot faster. In this particular case, this is a pretty hard hit, but we're going to get through it. And we got to remind the American public that all of that pent-up demand, all that wonderful spirit of just being Americans is going to come roaring back. And thanks to the leadership of the president and the vice president, they're getting us through this very, very difficult time. This is a war. You've heard this mentioned of President Trump being a wartime president. That is true. This is a war, unfortunately, a war that none of us saw coming. You can do a lot of scenario planning. You can do a lot of, war game type things. Nobody saw something like this coming that would hit unprecedented levels, not only this country, but across the globe. But this president, this vice president, I'm very, very comfortable. They have the leadership skills to be able to get us out of this.
Yeah, there's no question that he's the right leader for this time. I do have to say, my 16-year-old, we've shared about what we've learned during this time, and she said that the virtue she's learned about is that of gratefulness, and she's eternally grateful for her friends and her family. And I am so grateful for the leadership of this president, the vice president, the coronavirus task force, grateful for both of you in sharing your perspective at this town hall. It's our very first Latinos for Trump virtual town hall, which is wonderful, because I think it's so important that we stay connected during this difficult time. And one way to stay connected is please text VAMOS, 88022 to join our Latinos for Trump coalition. We want you all to be involved. People are asking, how can I help? I'm at home. I'm bored. I need things to do. Well, we've got a virtual campaign going, and we need our troops on the ground to make sure that we're staying connected to those voters and really focusing on our grassroots efforts. We want you all to join Army for Trump. That we have definitely a way for you all to stay connected, make phone calls from your house, be able to help us out during this time as we get ready for the November election. Yes, because we do have an election in November. And as we know, early voting starts in many of these states early on. And so we want to be prepared as we continue our efforts on this campaign. But I just want to say that, if you are interested in volunteering, go to donaldjtrump.com. There's a great way to volunteer and get yourself involved. You can actually do the work from your house, and it's a great way to help the president get reelected and stay focused, obviously, on keeping yourself busy too, which many of us are trying to do. So I also would like to say that we are here for you. Make sure you stay connected with us during this time. We are very proud of the incredible work that President Trump is doing, despite the fact that you have Democrats and like Nancy Pelosi and several others like Joe Biden who are spending more time criticizing the president than coming up with solutions. And also you have the fake news media as well, many of the liberal media outlets who are spending more time blaming the president for his actions instead of working with us to provide the information that the American people have. But this is why we come to you all directly. So you can take this information of what Alfredo has shared, what Dr. Torres has shared, and take it back to the community. So with that being said, I just want to thank you all for joining us tonight. We'll do this again. And please stay connected and stay at home. So with that, God bless you all. God bless America. And God bless President Trump. Thank you so much.
Thank you, Mercy.
Thank you. Thank you, Mercy.